Okay, so it's 2:02 on the East Coast, but it's about time for the session to start. So welcome everyone. As everyone joins in the waiting room, I'll admit some more people, but we have a good chunk of us here. So welcome to the course Climate and Health. Welcome to our first live session. We appreciate everyone who's joining the course from all over the world, and we've been really, really impressed with the quality of participants and the quality of the discussion so far. So thank you to all the participants, and thank you to the presenters that we're going to have today. My name is John Swope. You may have seen my name in the course in different places. I'm the instructional designer for the course. I am who you usually reach out to if you have questions about the course. So we're going to get the session started. To let everyone know, the session is being recorded right now. It will be posted to the website later tonight after it processes. As far as how long we'll be here for, on the course website, I think I said this session lasts for an hour and a half. Just given the amount of content we have, it'll probably last for 2 hours. You can drop off when you need to, obviously, but just letting you know that it will probably last for about 2 hours. And when you are on the session, if you could, please just mute yourself when you are not speaking. And I'll also do the same on my side. I can mute folks. So if you get a notification that you've been muted, that's probably just me. I mute everyone. And then you can unmute yourself whenever you have something to say, or you can also raise your hand actually in the, there's an icon. There should be an icon for you to raise your hand, or just type into the chat and let us know that you'd like to ask a question, that we can bring you in. If you need any support during this session, you can chat me privately. There's a chat area, or publicly, just everyone will say it that way. And if you have questions at any other time during the course, online learning at sgu.edu, that's the best way to reach me. So with that, we're going to get into the agenda. And the first thing that we're going to do today is we're going to introduce the course with a video that some of you have seen already, but we're going to play this video in its entirety for Ventura, who's not here today. And once this is done, we'll get into the first speaker. So I will start this video now.
Hello everyone, my name is Ventura Silva. I'm with the UN Climate Change Secretariat. I'd like to welcome you all to the open course on climate and health. I hope you would have a very interesting 4 weeks of learning on the topic of climate change and health. UNFCCC, or the UN Framework Convention on Climate Change, established regional collaboration centers together with key partners in 6 of the regions around the globe in order to support climate actions from those regions, and also to engage and convene the countries and implement the mandates of the UNFCCC. RCC St. George's, or the Regional Collaboration Center St. George, was established to support the Caribbean region in 2013 and was established together with the St. George's University and its Windward Island Research and Education Foundation, which is an institution dedicated for research and on various topics, including climate change. We have been working together with them and supporting the countries in the region on topics of adaptation, resilience to climate change, as well as mitigating greenhouse gases in the region. Bringing climate finance in order to carry out this work, introducing technology, as well as providing data and information for various decisions. We also host Global Water Partnership, the Caribbean chapter, the Green Climate Fund, the specialist for Latin America and Caribbean, the NDC partnership, which is targeting the nationally determined contributions, which are the actions which various countries are taking in order to contribute towards the achieving of the Paris Agreement. Caribbean Cooperative MRV Hub, a specialized project targeting towards reporting on the various climate actions from the region, as well as the PAHO, the World Health Organization Collaboration Center for the region. This year is a critical year in climate change negotiations. Later in December this year, the international community is coming together in Chile, Santiago, in order to finalize the implementation steps towards how the Paris Agreement is going to be implemented. In this context, it's good to understand how the healthcare sector would be impacted from climate change. What are the policies that are needed in order to address these various impacts, and also how the healthcare sector could better contribute towards minimizing the greenhouse gases or the emissions from the healthcare sector activities, such as the energy consumption. It's accounted 3 to 8% of the global emissions, mainly from some of the developing countries, actually is from the healthcare sector. It was also critical to understand the impact of climate change on achieving the Sustainable Development Goals, which was also another international agreement that came into place in 2015 together with the Paris Agreement. That recognized that most of the other goals within the 17 goals cannot be achieved unless we do achieve the goals under 13, which is the climate change goals. And hence it is important we develop further the knowledge around the climate change and health, how this is going to be impacted, and what are the policies that are needed in order to address these, so that we can contribute further towards the international community's target of stabilizing the global warming, and also developing better resilience towards climate change and adapting to the adverse impacts of climate change. We have lined up an international panel of experts from various organizations that have worked on the policy aspects as well as the science and the research on the impacts of climate change on health. And we would hope that you would have 4 weeks of interesting interactions. We are open for questions during the course, as well as you can reach us after the course if you have any questions or have any suggestions for us how we could develop further the knowledge on health and climate change. We hope you will carry forward the learnings, try to develop further the knowledge, and also educate others on this interesting topic and the opportunities as well as the challenges this poses on the healthcare sector. Wish you success with the course and looking forward to further interactions with you. Thank you.
Okay, and with that introduction to the course, I will now turn it over to Daniel, Mr. Buss, who's going to introduce himself and speak a little bit to the video. So Daniel, if I could have you unmute yourself and turn on your camera if it's not on, and I will stop my share.
Okay, thank you. Thank you very much for having me today. My name is Daniel Buss. I'm the advisor on climate change and health for the Pan American Health Organization. I'm based in Washington, D.C. just a little bit about the Pan American Health Organization. We are the regional office for the World Health Organization in the Americas. We work with the 35 countries and 18 territories here in the Americas, North America, Central America, Caribbean, and South America. And we are very, very happy to be here today because we have been collaborating for a long time now with St. George's University. So thank you very much for convening this session. SGU is a collaborating center with PAHO and the WHO on the topic of climate change and health. And also with a long-term collaboration with UNFCCC, where we have a memorandum of understanding. The WHO in Geneva, they established this memorandum of understanding, and we are doing a lot of actions together with the UNFCCC here in the region of the Americas. So along the lines that are covered in this memorandum of understanding, we have actions on capacity building and preparatory works with countries on topics such as mitigation, adaptation, climate finance, and raising awareness and increasing the engagement of the health community and health determining sectors around those topics. And we have a few products. I'll use it just as a teaser. That's why I'm not using a presentation here, because I'll have a proper session on climate change and health and how the health sector can respond to climate threats. It will be the third week of this course, but we have a number of products together with UNFCCC, such as the country profiles on climate change and health. So we have been working with countries around the globe, but here in the Americas, in a large number of countries where we do climate projections, and then we also project and we collect the data, existing data on what are the trends on weather and climate are impacting health and how is the health sector responding. We had a very interesting work together with UNFCCC and also SGU last year, preparing the Caribbean Action Plan on health and climate change. This was signed by ministers of health and ministers of environment of all countries and territories in the Caribbean. We are doing the same in Central America and in South America now. So a large number of countries together working on those topics to make sure that the health indicators and the health components are reflected in a national determined contribution, which are key documents for the UNFCCC, but also on national adaptation plans, which are the action plans, as the name says, at the national level, what the country will do with regards to adapting to climate change, and also the national communications, which are the official way of countries communicating with the UNFCCC and how they are advancing with implementation of what is described in the Paris Agreement and other resolutions at UNFCCC COPs. And also now, very recently, we started a strong engagement with the Green Climate Fund to support countries of the Americas to prepare projects, having health in the heart of those proposals, and really making sure that we have actions within the Ministry of Health or things that are under the management of the Ministers of Health, but also as a co-benefits of health in interventions that are done with regards, for example, with mitigation. One example would be air quality that is also improving air quality, and it's also have some benefits for climate change that reduces greenhouse gas emissions. So we are looking forward to work with you in those following weeks. Again, we are very happy to be here. We'll try to be as much as possible in those live sessions so we can establish an interaction with you. So please feel free to contact us with any questions and comments that you have, and we'll be more than happy to engage with you. And I also wish you a very good online training course, and I hope that we can move forward with this super important agenda. This year we have the COP, UNFCCC COP in Chile, in our region, And we also look forward to meet you all there. So thank you very much for having me today.
Thank you. Thank you very much, Daniel. All right, Satish, we'll turn it over to you next.
Thank you, John, and hello to the world. And I mean that in all sincerity. I have been very humbled by the cadre, the community that we have built, community of participants and our community of partners as well, as we deliver this course. This course, Climate and Health, represents the current installment on our One Health, One Medicine open access course series offered by St. George's University. And rightfully, topically, we have chosen to focus on climate and health, as we can appreciate this topic bears relevance and significance to each and every one of us, regardless of where we reside or belong to. My only request for this course is that we engage, we interact, and we learn from each other. I always find myself learning more than I give, which is a good thing, and for me at least. And I would like each and every one of us to gain that perspective. Utilize the entire learning community that this course represents. Feel free to reach out, interact in these live sessions, and throughout the various media that we have on offer in this course for interactions. You yourself represent expertise and experience where you reside. We would like to share and learn from your perspective, as well as, of course, our panel of experts that are partnering with us in this course. For this course, it is the expectation that we learn, but also hopefully incentivize a call to action. Our colleagues have already established the fact that we have ongoing international, regional meetings and deliberations on policies and practices related to climate and health. Wherever you belong, in a government agency, an academic institution, an international organization, you have a part to play. Utilize this course as part of your own continued professional development and, of course, your contribution to the overall global effort on climate and health. So we will begin this week with two of our panel presenters and our course team members. The first is Maryam Navi. Now, Maryam Navi is currently located in Bonn, which is the headquarters for the United Nations Framework Convention on Climate Change, and throughout her graduate and doctoral training, have spent a lot of time in different regions, different continents, including Australia to America, and at that particular point in time have fostered an interprofessional approach towards research, focusing on environment, on communities and health. Her focus currently with the UNFCCC is on adaptation. We have already established adaptation, mitigation, resilience as primary responses to how issues of climate and health can potentially be managed. So we welcome Maryam as part of this session and indeed this course to share with us in our first live session on climate and health. Maryam, over to you.
We can hear you just fine, Maryam. You're coming in well.
Well, I'm just trying to share my screen with you.
Sure. Do you see the green share button?
Well, weirdly I can't, but I will figure it out soon.
Okay. Find the Zoom screen where all the faces are, and then the green share button should be at the bottom. And if not,
maybe just bring the cursor closer to the lower end of the screen.
Well, I used to have it.
In the meantime, I can pull it up. So you keep trying to find it, otherwise I'll pull it up and I can potentially present from your screen here.
Maybe now I can
Try
share.
Alt and S. Alt and S.
Oh, there we are. I see your screen, Miriam.
You see it? Okay.
Yep.
Okay, great.
Great.
So you have me, right? Okay. Hello, everyone. And thanks, Satosh, for the kind introduction. As he mentioned, my name is Maryam Navi, and I work in the United Nations Framework Convention on Climate Change and work with the adaptation program. I apologize, my voice is a bit off. I have a cold and started losing my voice. Nevertheless, I'm very excited about this course, and I would like to thank everyone who joined us today. And I hope you enjoy the content of the course and find it useful. So, with that, let's get started. I will be talking to you today about climate change definition and the health impacts of climate change. I will provide you with some examples of heat health effects. I will also very briefly talk about non-climatic risk factors that play a role in health outcomes. And finally, I will speak to you about approaches to respond to the health impacts of climate change. I'm sure here everyone heard about climate change, but let's have a look at scientific definition of climate change. I'm using here the definition of climate change by the Intergovernmental Panel on Climate Change, which is an intergovernmental body of the United Nations dedicated to providing the world with an objective scientific view of climate change and its impacts and risk. And from now on, in my presentation, I will refer it only to IPCC, its abbreviation. And okay, with that, what is climate change? And by this definition, climate change refers to a change in the state of climate that can be identified by changes in the mean or variability of its properties, and it can last for an extended period of time, for example, for decades to millions of years. It could be a change in the distribution of weather events or in the frequency or intensity of weather events. For example, it means like having fewer or more extreme weather events. Also, before we move on to the next slides, I want us to be clear about differences between climate and weather. Weather is the condition of the atmosphere at a particular place over a short period of time, whereas climate refers to the weather pattern using statistical data of a place over a long enough period to yield meaningful averages. So what are the causes of climate change and how do we know? Well, scientists have pieced together a record of Earth's climate dating back hundreds of thousands of years by analyzing a number of measures such as tree rings, ocean sediments, and by studying changes in Earth's orbit around the sun. The record shows in general changes in climate before the Industrial Revolution can be explained by natural causes such as changes in solar energy, volcanic eruptions, and natural changes in greenhouse gas concentration. You can see here in this slide models using only natural causes, blue shaded band, models using both natural and anthropogenic causes, pink shaded band, and observations, which is the black line. So recent changes in climate cannot be explained by natural causes alone. As you can see here, natural causes do not explain most observed warming, especially warming since the mid-20th century. Rather, human activities have been the dominant cause of that warming. So here we can have a close look at CO2 concentration. And as you can see from this graph, for 1,000 years, CO2 had never been above this line. and look at the change after 1950, after Industrial Revolution. And this current level of CO2 is caused by the human activities such as burning fossil fuels, cutting down rainforests, and farming livestock activities. Also, I would like to invite you to watch a video by NASA on how carbon dioxide moves around the globe. The model combines satellite data with high-resolution weather model, giving a 3D view of carbon dioxide in Earth's atmosphere. I encourage you to visit the page after the course or whenever you get a chance, and read the article. It's very interesting. Also, there are some interesting questions there for you to think about. Okay, now that we have some ideas about climate change and its causes, let's talk about how does climate change affect human health. Scientific communities say that climate change is one of the biggest global health threats of the 21st century. And the health of human population is very sensitive to changes in weather patterns. World Health Organization estimated that between 2030 and 2050, climate change is expected to contribute about 250,000 additional deaths per year, mainly from malnutrition or some infectious diseases like malaria and heat stress. Here, this conceptual diagram by IPCC showing 3 primary exposure pathways by which climate change affects health. You can just look at the blue box and you can see the first pathway is directly through weather variables such as heat and storm. The second was indirectly through natural systems such as disease vectors. For example, climate change can cause mosquito to spread more rapidly and to new areas. And the third pathway is heavily mediated through human systems, such as disruption of food production that can result in undernutrition. And if you are interested to know more about the pathways, I recommend you read chapter 11 of IPCC 5th assessment report, which the link for that is available at the bottom of this page. Oh, now we are at slide 9, and I have a question for you. As you might heard from time to time in the news, weather-related hazard causes injuries, deaths, and increases in some infectious diseases. I'm interested to know, in your opinion, which weather-related hazards kill more people than any other in the US?
So we have a poll here. Yeah, just let me know, Maryam, when you want me to open the poll. I can open it now or when you're done going through the images here.
Yeah, I think when I'm done with the images, then you can, create the poll. So do you think it's flood or lightning? Is that tornado or hurricane? Heat, cold, winter storm, or the last one, wind? So now over to you.
Okay, so there should be a poll up on your screen. I'll collect answers for about 60 seconds or so, and then we'll show the results. Answers coming in. Okay, got some popular ones and some less popular ones. So we'll give it another 10, 15 seconds or so. Okay, all right, I'm going to end the poll. I'm going to share the results now.
Okay, great.
Can you see those, Maryam?
No, can you share? Can you just tell what was the most frequently?
Sure, the leader was with 40% of the vote, yes, followed by
Oh, that's great. I'm so surprised because this is the first time I'm asking this question and I'm getting the the right answer, so I'm very excited about that. Yes, in some countries, including the US, heat kills more people than any other weather-related hazard. So as climate change promises to bring with it longer and hotter summers to many places on the planet, let's see how heat affects our human body. Some of you might like hot weather, but extreme heat can overpower the human body. Heat exhaustion is a relatively common reaction to severe heat and can include symptoms such as dizziness, headache, and fainting. It can usually be treated with rest, a cool environment, and hydration. Heat stroke is more severe and requires medical attention. Symptoms include dry skin, a body temperature about 39.5 degrees Celsius, confusion, and sometimes unconsciousness. The two ways our body cope with heat are by sweating and breathing. The humidity is a huge factor. If you have tremendously high temperatures and high humidity, a person will be sweating, but the sweat won't be drying on the skin. That's why it's not just heat, but the combination of heat and humidity that matters. The combination results in a number called apparent temperature or how it feels. I'm sure you heard about that. The other major factor in terms of temperature that causes both mortality and morbidity is temperature that falls to in the evening. If the temperature remains elevated overnight, that's when we see the increase in deaths. The body becomes overwhelmed because it doesn't get the breathing space that it needs. When a person is exposed to heat for a very long time, the first thing that shuts down is the ability to sweat. We know that when sweat is dried by the air, there is a cooling effect on the body. Once a person stops sweating in a very short order, a person can move from heat exhaustion to heat stroke. Eventually, heat begins to affect the brain, and that's when people begin to get confused and can lose consciousness. The analogy some make is if you are driving a car and you notice that the temperature light comes on, what's happening is the cooling system of the car is overwhelmed. If you turn off the car and let it cool, eventually you can start driving again. But if you continue to drive the car, the problem goes beyond the cooling system to affect the engine, and eventually the car will stop. So that's why during the heatwave 2003 in Europe, so many people died. That was the largest humanitarian natural catastrophe in Europe for centuries. And as you can see here from the map, most part of Europe experienced high heat stress, orange color in the map, and some area experience extreme heat stress, such as France, part of Belgium, Netherlands, and Italy. The 2003 European heat wave, as an example, led to the hottest summer on record in Europe since at least the year 1540. It caused an estimated 35,000 deaths, and France had the highest number with around 15,000. People died at home before they reached hospitals. Many were elderly, families had gone on holiday, leaving elderly at home. Another example is 2018 Pakistan Heatwave. The temperature again was record-breaking. It was in April, and the temperature rose to 50 degrees Celsius. People were worried that the extreme heat started too early, and they were planning to migrate to other cities if situations remained the same. And the situation was worsened by long power cuts and little running water. Even though they have issued forecasts about the extreme heat in the province where the heat waves taking place, but they didn't expect a world record in the month of April. So, and with more heat waves on the horizon, the risk of heat-related health problem is increasing. But I also wanted to talk a little bit about non-climate risk factors, because the relationship between heat and health outcome is not always linear. Heat health outcomes are determined by a range of factors, from age, chronic illnesses, to individual behaviors, and to cultural and economic context. In this slide, you can see different levels. For example, our lifestyle, the way we dress, or the amount of water we drink matter. In the community level, when we think about people who are living alone, or migrants whose mother tongue is not English, it might be a barrier for them to ask for help and to get information how to cope with heat. There are also some socioeconomic factors such as income. For example, people with low income cannot afford to turn air conditioning on. Oh, sorry, I'm still here. Yeah. So when we are examining the relationship between hazard and health outcome, or any climate hazards, factors that make people more vulnerable to the hazard, here heat, and factors lead to higher exposure need to be taken into account as well. Also a little bit on mental health, because it's a very important issue, but we do not talk enough about it to do its justice. The psychological impacts of warmer weather on aggression and violence have been extensively studied. There is a causal relationship between heat and aggression, as in other words, as the temperature goes up, so does aggression. Also, direct experience with natural disaster can cause symptoms of post-traumatic stress disorder, including panic symptoms, nightmares, and phobic behaviors. For example, some preschool children who lost their homes to Hurricane Sandy developed a phobic avoidance of rain, waves, and thunder that generalized to panic about getting in bathtub, going to school, which they feared might flood, and going to swimming lesson. And as climate change changes people's lived landscape, large numbers are likely to experience a feeling that they are losing a place that it's important to them, a phenomenon called solastalgia. This psychological phenomenon is characterized by a sense of loss, similar to that experienced by people forced to migrate from their home environment. There are ways to respond to climate change, and that involves mitigation and adaptation approaches. Mitigation refers to reducing emissions of greenhouse gases in the atmosphere, and adaptation is to deal with the impacts of changing climate, to manage risk from climate impacts, protect communities, strengthen the resilience of people and the economy and natural systems. So here a little bit about what we do at UNFCCC with regard to health. UNFCCC can play a part in creating awareness that many of the drivers of climate change, such as inefficient and polluting forms of energy and transport system, also contribute to air pollution. One of the most important goals is to get all governments, people, and businesses to make the immediate transition from fossil fuels to more renewable forms of energy. This contributes to our climate goals of limiting global temperatures to 1.5 degrees, achieving climate neutrality by 2050, and reducing emissions by 45% by 2030. It reduces levels of carbon dioxide and other climate pollutants that are polluting our air, and it means boosting the health of our overall environment and the quality of our food and water. The Paris Agreement, which is an agreement within the United Nations Framework Convention on Climate Change dealing with greenhouse gas emissions mitigation, adaptation and finance, which signed in 2016, also acknowledges health as a human right in its preamble. So, countries submit reports, as Daniel briefly explained, and I'm sure he will explain more substantively in the module third, about some instrument under UNFCCC and the Paris Agreement. So under those instrument, countries submit their reports to Climate Change Secretariat. And in their reports, they talk about health priorities under mitigation and adaptation. Under mitigation, countries reported that they are considering alternative fuels in transportation sector, and they mitigation project proposed by countries in transport sector include the promotion of public transport and the use of bicycle. Some countries identified mitigation measures in the transportation sector that focus on technologies such as the introduction of electric and hybrid vehicles, and measures focus on behaviors affecting transportation. Under adaptation, parties reported on general options for adaptation, such as the improvement of living standards, increases in the awareness about hygiene, and strategies to control disease vectors. Some specific health sector measures included vaccination and prevention measures and monitoring of risk groups, especially in exposed areas. Priority actions reported include the development of health infrastructures, as well as training of and raising awareness among medical personnel. Daniel already mentioned about our memorandum of understanding that's between UNFCCC and WHO, under which we collaborate on several projects, and he explained about this climate and health country profiles, which aims to raise awareness of the health impacts of climate change. The profiles highlight the current stage of engagement in health adaptation to climate change process. There are currently profiles for 40 countries, but a new version is being prepared for this year with about 80 countries. So you may want to check it out and look at your home country profile or any other country you are interested to know more about it. So, and to end my presentation, I would like to ask you, if you were helping develop a policy in response to health effects of climate change for a new country, remembering the distinctions of mitigation and adaptation, what area would you focus more? And what measures and institutions would you establish, and why those? I'm looking forward to receiving your response or thoughts to the question. Thank you very much for listening.
Thank you, Maryam, and folks, you can respond to that question in the chat. It's a good question because I think it is related to some of the discussion posts that are part of the course. And at this point, I'll turn it over to Satish, who's going to introduce our next speaker.
Thank you, John, and thank you very much, Maryam, as well, for bringing that context into the discussion and continuing our presentation with another colleague, Gerardo Sanchez Martinez. And Gerardo is a senior advisor for the United Nations Environmental Program. And what is interesting about health is that health is as much a disease issue as it is a developmental issue, as it is a social economic issue as well. And that's one of the lens that Gerardo brings into the discussion, where his work focuses on the assessment of social, health, and economic impacts of climate change, as well as tracking how some of the interventions on climate effects actually can lead to policies and activities in this regard. Gerardo specializes in the preventive aspect of mitigating the effects of health, and disease in particular, including heat waves in urban settings, as well as extreme weather events. So we're very happy to have Gerardo as part of our course team and to present to you today. Gerardo, it's over to you.
Thank you very much, Satish, and it is indeed my pleasure to be part of this course on climate change and health. I was really very happy when I learned that the Collaborating Center of UNFCCC was engaging in this, and I'm also very honored to be in the same panel as the other discussants. Yeah, as Satish mentioned, I worked for the UNEP DTU partnership. This is a think tank and the Collaborating Center of UNEP, which is associated with the Danish Technical University. Before that, I worked for quite many years at WHO. And before that, at the World Bank, both in Latin America and the Caribbean and in East Asia. But at some point, I decided that I didn't care about money, and so I became an academic. There's gains and there's losses in that, as many of you know. But today I'm going to talk a bit about the second part of what Maryam mentioned. That is talking about what we can do to prevent most of the health impacts of climate change. And also how far we are from where we should be to prevent those impacts. Most of the materials that I will present today come from a report that we coordinated called the Adaptation Health Gap Report. And this is commissioned by UNEP. It touches upon various topics, and last year was on health. And so we used the opportunity to compile evidence on health impacts of climate variability, weather extremes, and also on preparedness and state of prevention in some of those. When this project landed on my desk, it came already with a definition of what that health adaptation gap was. And for the people, those of us who work on public health, we're not necessarily familiar with this kind of high-level abstract definitions. This one was something along the lines of difference between the climate-related health outcomes and their actual, that means current adaptation efforts, and those that would occur if we had enough health adaptation. And so it talks about a societally set goal for adaptation. And so it sounds pretty good and solid, except many of the elements in that definition, we really don't know very well how to measure them. To begin with, it is a very complex set of causal relationships. Like what Maryam mentioned, there's direct and indirect effects. And I'm going to be talking mostly about current climate variability and climate impacts. There's air pollution, there's social factors, there's poverty, there's development. Crucial conversation because prevention of health effects of climate change and development go hand in hand, of course. And so with that causal network, and also many challenges like an incomplete baseline information on the exposures that we're talking about, on the attributable health outcomes that we're talking about, importantly, on the effect modifiers and the confounders. So we have incomplete baseline information everywhere, but also unequally so. We have a patchy coverage of data on efforts towards health adaptation. We have uncertainties in projections, and very importantly, we do not have a societally set goal on adaptation. I mean, as of today, the global goal on adaptation is very little more than a line on an agreement, but operationally, it's very difficult to act upon. So what we did is we focus on big ticket items, mostly direct impacts, and also climate-sensitive infectious diseases, nutrition, and food security. We capitalized heavily and shamelessly on ongoing initiatives of global scope from WHO, from the Lancet, the IPCC special report, etc. And we took a health systems perspective, and that's because we wanted the conclusions of this compilation to be operationally relevant. Now, there's a lot of data that we compiled. I definitely encourage you to look at it in detail. But the baseline situation is that there is a quite significant current burden of climate-related illness and mortality. And it is largely preventable. We know pretty well the kind of things that we should do to prevent those. And there's an ecosystem of actions that are in place, but very little that can be aggregated or compared. We have seen that there's systematic underfunding, even for those things that we know very well how to do, and that they are very highly cost effective, like basic development sections of the SDGs, malaria control, and so on. And because it is so complex, I'll present to you today this narrative based on just 5 figures. And they're going to go from huge to very tiny. And let's go for the first. The first one is 2 billion, American billions, so thousands of millions. And that is the number of people affected in the last 2 decades globally by floods. Now, heat waves may be the most deadly of extreme weather events, but flooding also causes a great amount of misery by affecting also people's livelihoods, forcing relocation, and it has very clear and increasingly better known mental health impacts in the long term. And so it truly is a tragic figure that 2 billion people are affected significantly. And that's something to take into account definitely for adaptation efforts. But let's continue. From 2 billion, so we're going to go to 96 million. It's also quite significant. That's the number of estimated cases of dengue fever. And for those of you who are not familiar with dengue, dengue is caused by a virus, which is transmitted by the bite of a mosquito. And it is tremendously painful, aside from a very serious disease. There isn't a really valid for every case a vaccine, though there is a vaccine for dengue, but it's not one that can be used in the whole population. And what's important also is that those 96 million cases are actually estimated. We don't really even have enough diagnostic capacity to figure out the real numbers. It is truly a tragic number, but if you even compare them with the others, 212 million cases of malaria, chikungunya, Zika virus, and most of the numbers of Zika is actually suspected because some countries, actually majority of them, have given up on surveillance of Zika. So it's the situation became so bad that they stopped counting numbers of cases. And so all of those vector-borne diseases actually can be acted upon and are largely preventable. Yet that is the situation that we're facing today. Then in terms of like basic development issues relative to infectious diseases, 29% of the global population does not have access to a safely managed drinking water service. And that is, by the way, is a standard is way lower than a tap at your home. Safely managed drinking water service can be something very basic, and they don't even have access to that. 61% do not have access to a safely managed sanitation service, which in terms of public health is almost worse. And we don't even have enough data on hygiene to produce a reliable global estimate. We should be spending more than additional $6.5 billion US per year by 2020 just to meet the first milestone on the global technical strategy for malaria. We keep on seeing increasing numbers of dengue, among other things, because the reporting gets a bit better, but it's still, it has basic shortcomings. And for many other vector-borne diseases I mentioned, we don't even have reliable data. Let's go for another number, going down, but not in seriousness. Those 10.1 million are additional stunting cases for children under 5 and their base case economic scenario estimated by WHO. And stunting, again, for people who are not familiar with that, is the kind of malnutrition that will leave scars and consequences for life, for mental development, for physical development, for earning ability, and for about any other health outcome that can be measured. So 10.1 additional million cases is truly a tragedy that we can barely afford. And now we're going down. Less than 1%. Less than 1% is the international funding flows for health adaptation virtually negligible that we're seeing. So I would like you to put in perspective the numbers that you've seen on the one hand, the many millions, and the percentage of the flows, the economic flows that is being dedicated to that. We do have a lack of comparable estimates on health costs, the cost of adaptation, and the benefits of adaptation, but we have a growing pool of case studies. And the health economics of this are also astounding. There's many millions, many projected millions in health costs, both in developing and developed countries. In the EU 27, projected health costs are estimated at 106 billion euros by 2040 to 2070, including only a very small subset of health outcomes, by the way. And we even have actually benefit to cost ratios of some of the preventive measures that would be necessary to avoid those. Like for instance, before Maryam was talking about the health effects of heat waves, and we actually know that in that particular case, prevention is very cost effective because it costs very little and it can prevent a lot of mortality. So for every dollar spent on prevention, you could get $11 back in return in London, $308 in Prague, and $913 in Madrid. So it's very highly cost beneficial. Now, what's important too is that most of the global assessments really underestimate health-related costs because they include only a small proportion of the health outcomes. They count mostly direct damage because that's easier to count, and only effects on GDP when they are microeconomic models. So even these huge numbers actually are underestimates. Now, from a broader development perspective, what needs to be done is we need to do the things that we know well how to do and that we know that they are very cost effective. And here is where my academic position allows me to get a little bit out of the official line. And not all SDGs are born equal. Some of those are things that we know very well how to do and that provide very good value for money and that are proven to provide very good resilience of communities, including climate resilience, such as nutrition-related ones and early education for young girls. So those are the ones that I think and evidence shows we should be putting most of our money into. There are other SDGs that are very difficult to define and that we don't know very well that are going to be providing value for money. And so countries will be very well advised not to take them at face value and to do a very good evaluation and prioritization in their cases because resources are scarce and they want to be making sure that they're spending their money where they're going to get benefits in terms of development and also in climate resilience. There are some regulatory frameworks out there in terms of including health adaptation in governmental plans. There's actually an increasing number of them, but not nearly enough. We need more of them. We, according to the data that we've seen on the ones that are published, we actually need better ones, so ones that are based on better evidence. But most importantly, what we need is for those that exist to count, meaning that to have enough budget allocated to them and to be implemented. So one of the problems of health in the national adaptation plans, and Daniel can talk more about it later, but it's not only the case in Latin America, is that most of those health provisions are in fact taking a long time to get implemented, and some of them are simply not being implemented. So we need more, we need better ones, and we need for those existing to be implemented. Now, from a health systems perspective, aside from strengthening the evidence base and the regulatory framework, we need to build the climate resilience of health systems, and there is an increasing amount of literature on that, but also of activities. So we need to focus on many different issues. WHO published a operational framework for the resilience of health systems, and it has, I think, 10 areas. Most importantly, though, one needs to pay attention to the workforce and the facilities. So just climate-proofing hospitals is not enough. The fundamental part of health systems is actually the people, is the workforce. And you need to make sure that those are resilient and that they can continue operations under extreme weather events and after them. And of course, we need cross-sectoral engagement of the health sector and, of course, funding. Health represents globally a very large sector, around 10% of global GDP. Now, most adaptation financing mechanisms can consider health projects, yet very few large health projects have been implemented in the area of climate change. There's almost no correlation between their presence in the NDC priorities, and the truth is, health is always put together in any introduction of climate documents as a justification for action. But then less than 1% of the financing went to health. And as my dear friend Sergio Sanchez used to say, priorities that are not in the budget are not priorities. That is the truth. If there's no money, it's not a priority, as simple as that. We need to dispel the notion that the health sector should undertake adaptation without additional support. Additional support is needed, both human resources and money. And for that, we also need to build the capacity of the health sector's focal point to present successful proposals for adaptation funding that is specifically earmarked for health. So in summary, current efforts to bridge adaptation gap in health are well below where we should be. The progress in bridging that gap is mixed, with great variability within and across countries and regions. Climate change will increase those health impacts unless serious actions scaled up, and we need both political will and the necessary financial resource to narrow that gap. Now, I'd like to present a last number. This one is tiny. It's 0.25%. And that is the proportion of delegates in the climate COPs that are affiliated to a health institution. 0.25%. We actually analyzed 20 years worth of COP participants. And that's what we found. And by the way, many of those may not necessarily be health professionals themselves. They just may have an affiliation related to health. So that is the situation. And for any of those that have been in a climate COP or any other multilateral institution, if there's no representation of a sector, the sector doesn't count in the negotiations. And it doesn't count because you need to be there where there's many competing priorities and many issues that need to be addressed. And even issues related to defense or justice are far better represented in the climate COPs than health is. So those are the figures. I'd like to leave you with those. And I'm looking forward to our discussion and to hearing about your questions and to addressing your concerns or anything else that may be of your interest. Thanks a lot.
Thank you very much, Gerardo. Okay, so at this point, what we're going to do is we're going to open it up for question and answer session. There are two ways to ask questions. One is you can chat them into the chat box, and I'll queue them up and ask them to both presenters or anyone, and anyone can answer. The second is there is an icon to raise your hand. If you are in the Zoom window and you click on participants, you should see under the participant names there's an icon to raise your hand. You can raise and lower your hand that way. If you can't find it, then you can use any of the icons. Really, there's a yes icon. I can see any of them that show up. And if you have trouble with all of that still, you can just chat and say, I have a question. And what we'll do is we'll get you into the queue, and to ask your question, you can come on to a microphone and ask that way. So chat or raise your hand to ask a question on the mic. And we have a couple already, so I'll scroll up and try to do these in order. And I actually got one on email, so I'll start with that one. The question comes from Ruth. and it says that Chapter 11 emphasizes the fact that health issues are exacerbated by climate change. However, looks like Gerardo, they're kicking you out.
Yeah, they're going to start cleaning.
Sorry. The fact that health issues are exacerbated by climate change. However, there is little communication to the public. How can the health sector better communicate this to their constituents outside of epidemics like dengue? The energy sector has been doing a good job, but the health sector seems to be lagging. So, Maryam, I'll give this one to you first, since this came up during your session. And you're muted, I think. There you are.
Thanks for the question. Yes, I think that's a very important question. I think the activities and actions that health sectors has taken so far has been different and uneven in different countries. And it can have like so many factors being involved. But for example, in Australia, because that was where I was doing my PhD there, there was a heat wave during 2009, and then there was a quite big number of people who were hospitalized, and there was a big number in ambulance call-outs. So then after that, they were thinking about some intervention activities, and they put in place a warning, heat wave warning system, and they had this definition of heat wave, and they issued, or I think even now they issue a warning when a heat wave is approaching. And they had a intervention plan that was a collaboration between Red Cross and Department of Social Inclusion to have a registry of vulnerable people and to call them and check on their health and well-being during the heat wave. And then again, when they had the heat wave during 2014, and they did evaluation of their public health intervention, the amount of the number of mortality and morbidity due to heat wave decreased substantially. So there are some actions taking place, and there are some indicators being implemented, like warning systems. But yeah, I understand that there is a long way, and there is a lot that can be done in many countries.
Thank you. And Gerardo, I'll ask you the same question. You can answer it, or say Maryam answered. I'll summarize by saying the question was, how can we better communicate the fact that health issues are exacerbated by climate change, and there's little communication in the public about this?
Yeah, well, I mean, that's actually, that question is absolutely on the money. The truth is there's very little communication on that matter, and the best people to do that kind of communication would be definitely the health sector. Now, we consistently see that health professionals are among the most trusted voices in society. That happens almost everywhere, and they need to be the ones carrying the message. And there's a few reasons why that is not happening. The first one is on basic economics. Most of what climate change entails for the health sector actually has to do with prevention. And prevention usually takes on average around 3% of the money that is spent on health, as opposed to 97% on everything else, mostly curative parts of it, treatment, technology, and so on. So prevention already is a very minor part of health expenditure, and so it's going to have a lower priority. That's for sure. Another thing is that it's very difficult to convince health professionals, for some valid reasons sometimes, that a systemic issue such as climate change is in fact within their competencies and within their responsibilities. And that's because they definitely have a lot of competing areas for attention and emerging issues that they need to pay attention to. And yet, in terms of health impacts, it's definitely something that should be high up in the agenda. So that's like, those are like the internal sides of it, but this also needs to be recognized that most of the adaptation that is necessary to prevent the health impacts of climate change actually needs to happen beyond the health sector and the health system. So it needs to happen in infrastructure and in water and sanitation and agriculture, and all that the health sector and health professionals could do is, on the one hand, evaluate the possible health impacts and health benefits of those interventions, and on the other, trying to advocate for those things to happen. But it is not within their competencies. And so there's two sides of this. On the one hand, they need to be doing more internally. On the other, they need to be engaging more with other sectors to make it happen. But this is something that needs to, on the one hand, happen internally in health systems, and also needs to be enabled by policymakers and more strategic players.
Yeah, good first question, Ruth. The next question comes from Nicholas in the chat, and it was partially answered, but I'll give Maryam a chance to answer as well. The question is, isn't there an alternative to mitigation or adaptation due to recent technologies such as extracting CO2 from the atmosphere? And Gerardo, I'll summarize your answer in the chat basically, but is that CO2 capture and storage is basically not enough. We still need more cuts. So Maryam, do you want to add anything to that?
Well, I think this is a question on geoengineering, and the best option for sequestrating carbon from the atmosphere is currently biological sequestration, especially reforestation and afforestation. Non-biological forms of carbon capture and storage are also viable in many cases. Geoengineering solutions, especially solar radiation management, are still at the experimental phase, where adoption of that is still can be a viable path, but they are still at the early phase.
Right.
Just to complement that, I mean, it's like the exactly like what Maryam mentioned, the non-biological possibilities for carbon capture and storage represent an infinitesimal proportion of what needs to be done. So we're talking about like many orders of magnitude of difference.
Great. Okay, I do see a hand raised, so I'm going to go to that one next. Anesia. So what you can do, Anesia, I see your hand, you're up. You can click on the unmute icon and come on and ask your question. I'll give you a second to work that out. I can actually unmute you on my side as well. There you are.
Okay, good afternoon, everyone. Can you hear me?
Hear you well, yep.
Okay. We're well aware that fossil fuels are being exhausted, and as a result of that, we're looking for more the use of more renewable forms of energy. One of that form of energy that we are going towards is that of solar energy using solar panels. However, I want to know what measures are in place. Some of the solar panels, I mean, there is a long lifespan for it, but what measures are in place to deal with these solar panels at the end of their use? How do we get rid of them? Because if we don't dispose of it properly, it can lead to a lot of health hazards.
I'll send this one to Gerardo first.
Okay.
And it's going to be quick because I actually have no idea. That's definitely outside of my field of expertise.
That's a fair answer. Maryam, anything to add, or we can?
Well, no, not from me.
All right. Well, it's a good question. So maybe with Satish and I, we can figure out something and pull something up and get you an answer. I'll write down the question, Satish, and maybe we can.
Definitely. We can talk to the right people and get back to everyone as well.
Yeah, exactly. Thanks for your question, Anisha.
Okay.
Okay, the next question, we're going to go back to the chat. The question is from Jan or Jan, I'm not sure how to say it. And the question, how is the attribution to climate change for health impacts made? I will start with Gerardo.
Yeah, and again, another question exactly on the money. Attribution is the key. Is the key in theory, though. I mean, because like the short of it, short of the answer is attribution to climate change, attribution of health impacts to climate change is for the time being a modeling exercise, as in trying to subtract, plausible baselines from plausible current scenarios, so according to the data that we have, and plausible near-term future scenarios. And in the long term, it becomes easier because there's more signal and less noise to analyze. Now, it is a question that when it comes down to the practice of it, it becomes a bit less relevant than one may imagine. That's actually the opposite of what usually happens, right? And it becomes less relevant because most of what we know we need to do to address those health impacts is actually standard public health practice. And so it's something that we should be doing anyway. And the attribution part becomes a lot less important when you actually take that perspective. But the short of it is basically a modeling and a statistical exercise, the attribution for the time being. That being said, it's actually becoming less and less uncertain, that exercise, as time goes by. Emissions don't go down, increases in temperature and other exposures go up, and they are better attributed to climate change, actually. So that's essentially the overview of it. I don't know, Maryam or Daniel, if you'd like to say something else on that.
I think you answered it properly. I wouldn't add anything to that.
Right. Okay, the next question comes from Alexandra, and the question is, how do we manage resistance when we encounter it? I find a lot of people in my home province in Canada speak about this issue without knowing the data and statistics, and it's very frustrating. Maryam, we'll start with you.
Well, yeah, I think education can play an important role. So yeah, awareness raising, and we should start, I think, behavioral change and doing things. I mean, for me, as a person working in the climate change secretariat, I still think things should start with me. I mean, with behavior change, how I do manage my waste or use public transport, and just to be an example. And I try to explain things for example, for my family member. But I believe that we need like a broad scale education on that. And there are like currently some, as we have like some courses on that, but they are also bringing it into universities and to like school context and textbooks. So it's a long way, but I don't know. I personally don't, if people are getting defensive or persistent or don't want to listen, I personally don't push it. I will just try to be an example. But that's just from a personal point of view. I think things should be done like in a very broader scale. And the change would be gradual.
Exactly. Gerardo?
Yeah, that's something, of course, it happens a lot. I think like from my experience, I would mention 2 points. One of them, the first thing is, I think it's important to be humble and not to be arrogant in one's discussions, right? And because the truth of the matter is there's many things that we don't know very well how they're gonna work. And so one case in point is the energy transitions that are necessary for the reductions in greenhouse gas emissions that we need to achieve. The truth of the matter is that you cannot propose something like that as like a blanket kind of policy. Whenever that's been proposed, it's had lots of impacts on people's livelihoods, employments, and they also have been very unequally distributed. And so it's important to understand that people who are critical with the actions that are taken may actually have a point, and that their perspective needs to be taken into account. That being said, with the people who just go about like denying the facts, I think it's important to be clear that someone, with an opinion without facts is just an opinion, right? I mean, on the side of the health impacts of climate change and of the impacts of climate change, there's an army of scientists and experts that do their evaluations actually pro bono, and they very largely agree on those things. On the other side, there's a bunch of people that are largely paid for by lobbies, and there are very few even. And so that's something that it cannot be presented on a balanced kind of like, 2 points of view. There is one wide consensus, and there are some vested interests arguing for the contrary. And so that needs to be clear. I mean, those numbers matter, and also the fact that opinions without facts are just opinions.
Great. Satish, I see your hand raised. I assume that's intentional.
Yeah. Yes. Yeah. Thanks, guys. And I'm really enjoying this session, as well as we distill and we incise and disorient the entire exercise of how we attend to climate and health as well. Now, my question is, 1/4% of all the persons involved in the effort on climate change are associated with, are categorized as within the health industry. And that's concerning to me, but it's also an opportunity. It's an opportunity for us to bring health closer or more into the agenda by virtue of personnel. What do you think accounts for this comparatively low representation? And what are strategies that we can all use towards increasing that level of participation among those categorized as healthcare professionals?
Yeah, thanks, Satish. Well, I think, again, like it's the sort of relatively low engagement of health systems and the health sector in climate policy and climate negotiations. It's a combination of factors that brings it there. But essentially, there's like a discussion about like whether it is or not the competency of the health sector, how much of a responsibility and how much they should actually do, given how much else they need to be doing. I mean, like health systems around the world are under pressure from population aging, from healthcare costs. Many of them are barely sustainable on the financial side. And so actually asking health professionals and the health community to take on more is a very tall order. On the other hand, there is already encouraging signs. Medical associations, including the World Medical Association and the British Medical Association, and in Canada as well, they've all actually divested from fossil fuel companies. And in some cases, that's a very big deal, because that means that they are divesting their pension funds from those industries, and so that actually carries economic weight, and it hits what it hurts, right? I think there's two sides that are important to take into account. On the one hand, is really trying to bring over the health community into this discussion, as in, yes, we think you're welcome into this discussion, first of all, and secondly, actually enabling them to do so. So actually dedicating enough money so that they can build their capacity, so that they can actually apply for and get money so that they can participate. I mean, it's a vicious circle, right? I mean, if they don't have the capacity, then they cannot apply for money, so they cannot actually participate in the policy cycles, right? So I think we need to start by capacity building, and it needs to start early on, including actually medical education and nursing education.
And just to draw reference to the introduction discussion that we've had in this course thus far, as participants enroll into the course and introduce themselves, what I found was that there are a lot of persons situated in health, and one of their burning questions or expectations for this course is for them to specifically identify the linkage between climate change and health. So even for healthcare workers, they are having difficulty with that link, and that may serve as a barrier towards healthcare workers even identifying climate change as an issue for them to participate in as well.
Yes. Yeah, that is the truth. And it needs to be, again, it needs to be something that is relevant to their everyday practice, right? And so in some places, central health systems and administrators are being better at making it relevant by saying how it's going to affect, for instance, specific health outcomes in the areas where health practitioners are working, right? On the other hand, increasingly, there is some groups of health professionals taking up a role in sustainability and also mindful about climate change impacts. And that's the case particularly with movements of associations of nurses in many countries. So there's hopeful signs in there, but there's a lot of work that still needs to be done.
Thank you.
Okay, we're going to go back to the chat, and we'll see. We have more questions that we have time for. We'll get back to the chat for some of them. This next question comes from Kissy. It is, how important is biodiversity to climate change? Miriam, I don't know if this falls in your wheelhouse.
Sure, yeah. Well, biodiversity is one of the common agenda of Rio Convention, which is United Nations Framework Convention on Climate Change, and CBD, UNCBD. So they actually very comprehensively take care of biodiversity, but it is also an important item for us, especially for adaptation. And we are trying to find linkages between our this agenda item under our legal instrument with CBD, and collaborate more on to bring this closer in tackling the impact of climate change. But I mean, in the area I'm working with, we do not actually deal with it as much as CBD, UNCBD is working on that.
Great. I'm going to move on to the next question. For either of you, if you want to step in on something, just say so. But to get more of these questions, I might just ask one presenter for certain questions. So the next question comes from Sharon, and the question is, where can we get more information about the relationship between heat and violence/aggression? Gerardo, I'll start with you.
Yeah, actually, well, you can find a paper of mine on the matter. No, yeah, the thing though is that on the one hand, the link between temperatures and aggression, violence, and even crime has been known for a while, but it's problematic to do a direct attribution of behavioral matters to temperatures, because the causal pathway of behavioral outcomes and crime and aggression and violence is very complex. So it's very easy to mistake causality for something else that might be happening at the time. And so, for instance, an example that is clear is how in some locations and in some instances, higher temperatures lead to more drinking. And it is the drinking that leads to behavioral outcomes and violence, not necessarily the heat. Because in other places where there's not so much drinking, that heat doesn't lead to more drinking alcohol, right? So it's a complicated matter, but we're learning more and more about it. And with better data, we're able to control for those effect modifiers and in some cases confounders. And yes, there is a link between temperatures and aggression and other behavioral outcomes.
Is there a place where we can get to that article?
Most of the, I mean, at least a few of those papers that I've been involved with and that address those issues are actually open access. So just Googling the matter in Google Scholar, you should get a few hits that you can just download for free.
Super, thanks. Okay, I see two questions from Madhav, so I'll try to put those together in the next one. But first, I have a question from Deborah. And the question is, I was wondering how the signaled U.S. withdrawal from the Paris Agreement will impact climate change mitigation goals. And I'll start with you, Maryam.
Well, for now, the US is still a party to the Paris Agreement, so we will have to see how things will evolve.
Yep. You want anything, Gerardo, or is that?
Yeah, I mean, like, I think, but this is strictly my personal opinion, though. I think there's two sides to this. One is the actual symbolic value of American policy as of late regarding multilateral climate policy. That, I think, sends a very strong message, and one that is very disconcerting to smaller countries and other large emitters as well. That being said, it is actually not clear at all the actual numerical influence of federal policy in a place like the US, the influence that could have on actual emissions, given the decentralization that happens in the US in terms of regulations of industries and everything. So it's like, it's just the federal level that would be actually getting, on a different level. But a lot of it is happening at the subnational level. And certainly many cities are actually rising up to the challenge in a way that has never been seen before. And part of it is because of these kind of policy changes that we're seeing.
Thank you. Okay. The next question comes from Madhav, and it's two texts. I'm not entirely sure if it's a two-part question or two separate questions. So I'll say it all, and Maryam or Gerardo, you can step in and contribute an answer to it. But the question is, how does ecotone, E-C-O-T-O-N-E, play a role in climate change? As we talked about heat wave in this session, so how is this generated and how do we mitigate it?
I'll take up the second part of heat waves. In terms of, I mean, high temperatures is something that has always happened. There's some things that are making it different and more serious in some cases, combination of things, right? On the one hand, because of the epidemiological profile of heat, an increase in vulnerable populations, such as more people with chronic illnesses or older people, actually increases the overall risk of the same temperatures, everything else being equal, right? Another trend to take into account is the urbanization trend, because again, everything else being equal, urban landscape tend to accumulate more heat, and to actually keep it at high temperatures, relatively much higher temperatures than surrounding areas during the night. So the accumulation of higher exposure and more vulnerable groups accounts for larger impacts of higher temperatures. And then actually we have seen a statistically measurable significant increase of high temperatures, both in intensity and in duration and in the length of the hot season. So all of that is happening at the same time, while prevention is being put in place. And so in some places we're seeing prevention actually working and reducing, even in the face of increasing risk, actually reducing heat-related mortality. And in the places where that is not happening, we're actually seeing an increase in heat-related mortality.
Thank you. I see your question, Jan, in the chat. I'm gonna get to the next one so that folks who haven't had a question answer will have a chance, but if we have time, I will definitely go back to it. The question is from Esther, and the question is, I have found that the health sector does have programs which address climate change. However, these programs or the actions are not identified as climate indicators. For example, some health ministries have vector control programs which monitor mosquito-borne diseases trends in relation to climate. How does the health sector streamline their programs to be identified as climate health indicators? We'll start with Maryam.
Well, as far as I know, some countries have indicators in place. For example, I know that Australian Department of Health, like a few years ago, started doing research and doing environmental health association analysis to find climate and to identify climate health indicators. That's what I can say for now. Like they are not actually not all countries, not health, all the national health sector moving with the same rate or same speed, but there are some progress being made on the ground.
Thank you. Any thoughts, Gerardo?
Yeah, on my side, I mean, from a pragmatic point of view, I don't necessarily see any problem on activities that are designed to prevent health impacts of climate change not being labeled as such. That being said, actually, for the indicators on how much progress we're making on health prevention of climate impacts, it's something that it should be based on ongoing collection of information anyhow. I mean, when countries and governments are asking us how to start doing their monitoring and evaluation of health impacts of climate change and prevention, we usually tell them to rely on existing information and existing monitoring and collection systems. So I don't necessarily see a problem. Now, that being said, we are heading towards a time where climate action transparency will be fundamental for countries to access funding. And so it is a problem if you're not able to collect the indicators that you need to actually do the applications for funding that you will need, because transparency is something that is becoming an important issue for most donors.
Thank you. All right, a few more left. We're going to get to next Nikisha, who asks, if the mitigations and adaptations were to be implemented successfully, how long would it take to see positive effects or improvements in the environment, i.e. reduction in heat waves, reduction in damage to the ozone layer, or a reversal in adverse health effects? Start with Maryam.
Well, I'm just actually reading that question. I think under base case scenarios, if we achieve net zero emissions by 2015 in accordance with the IPCC 1.5 report, the worst of the impacts would be avoided. And adaptive responses would be effectively enabled to avoid any major negative impacts in all sectors, including health. But if we cannot achieve the needed levels of mitigation, then major costs can be expected in addressing the impacts as well as irreversible losses and damages.
Yeah. All right, I'm going to go to a question from Nikolai. And the question is, well, it's a two-part question. One, would you say that SIDs are at a greater risk to the effects of climate change? And two, how do we balance mitigation and adaptation? Either question for Gerardo.
Yeah, I mean, sort of everything else being equal, I mean, like levels of development and such, you would say that typically small island developing states have usually a high risk profile of risks of climate change. There's also very visible, as in sovereign nations that are facing almost existential threats. I think rather than that the actual data on the actual risk that they're facing, because there's a wide variability in states, is actually the visibility and the drama of a sovereign nation facing an existential threat from climate change, right? That's actually something that is very visible. But many states are actually experiencing firsthand very direct impacts of climate variability, including extreme weather events. And in that regard, there tends to be a higher visibility. Now, in terms of the actual burden of disease from climate change in states, I'm afraid we don't have good enough data to say something like that. And in terms of balancing mitigation and adaptation, well, first of all, some adaptation activities are also mitigation, and I'm thinking about agricultural interventions such as those related to irrigation and so on. And then the second, in terms of balancing, I think we need to be making sure that the transitions of both of those types of policies are fair enough, and that you're trying to get most of the economic and social benefits from both types of policies.
Right. So we're going to have two more questions, one from Jan, one from Alexandra. It's getting late for our panelists, and I will ask both of these to both of you. The first one comes from Jan. How educated on climate impacts is the medical profession? I'll start with Maryam.
Well, sorry, can you say the question again?
Sure. It's how educated on climate impacts is the medical profession?
Maybe Gerardo can go first.
Yeah, I don't know if you want to.
I'm checking my train not to miss it, sorry.
Oh, no.
But it's getting too late here, and I don't want to miss my train to home.
Okay. Well, tell me. Yeah, you gotta head out. It's fine.
Well, I mean, I'm going to answer the question in the meantime. The short answer is we don't know because we don't have good data. But the data that we have seem to suggest that not much. And so that actually comes from a systematic underestimation of the health impacts of climate factors. So for instance, there's a systematic underestimation by general practitioners, and that's actually a study from the EU on the health impacts of heat waves, and it's not an exception. So the data that we do have suggests that there's very low presence of climate change materials in medical education and low levels of awareness, but we don't have good data on that.
Thank you very much. Okay, so the last question is from Alexandra. It's about pipelines, and maybe Satish and you and I can look into that and see if we can post an article, but I won't present it to the panel since it is getting late, and I don't want Maryam to miss your train. The German trains are always late anyway.
Yeah, that is true.
All right. I'll say thank you to the panelists. Thank you very much for staying late with us. Thank you very much for all of your time and your answers. And I'll hand it off to Satish to close out this session.
Thank you very much, John, and thank you very much, Maryam, Gerardo, Daniel, who was with us, and thank you to each and every one of us as we shared in this conversation today. Now, while this session ends, the conversation continues, because as part of week one, we do have a discussion prompt, and the discussion prompt is for you to reflect on where are you located, your environmental context, and share with us your location as well as what you think are some of the climatic determinants that can impact health and disease where you are particularly located, and we will continue to share and build on that topic going forward throughout the remainder of week one. I'd like to remind us that this is week one for the course, and in week two, we will target health and disease specifically. But I must admit that there will be a bias towards vector-borne diseases in terms of the essence and the flavor of week two. So having said that, appreciate your time and looking forward to weeks two and throughout the course as we engage in the topic of climate and health as part of our One Health, One Medicine series at St. George's University in partnership with the United Nations Framework Convention on Climate Change, the World Health Organization, and of course, Gerardo and colleagues at the United Nations Environmental Program. Keep well, guys, and I'll see you all online. Bye for now.
Thanks a lot to everyone.
Thank you.
Thanks. Goodbye.
Bye. Bye.